Hi, Dr. Kirsten Ferguson with Front Creek Chiropractic Center and Vitality Doc. And today I'd like to talk to you a little bit about low back pain and some ways that you can manage this while you're stuck at home. So the low back frequently gets itself into a fix because you have been either sitting in a soft chair or a couch for too long, or maybe you've gone out and tried to play weekend warrior out in your yard. So ice is always a good thing to use for this. And always ice an hour or more before you would exercise. Or if you come in from working in the yard, ice at that time. Don't ice and then go out and try to get active, okay? An Epsom salt bath is another great way to handle an aggravated low back at this time. A foam roller is a great option, and we'll do another video where we talk about how to use the foam roller for the low back. And then also working on hip flexor and hamstring flexibility. There's some gravity yoga shorts that you can get through my YouTube site, Vitality Doc. Also, there's some full-length gravity yoga videos that are an hour, which I highly recommend for hips, spine, and hamstring flexibility. You don't have to do every pose with us, just do what you can. But let me show you a really quick couple of exercises that you can do at home. So the first thing we want to look at is hamstring flexibility. So if I sit straight up on the mat with my feet straight out in front of me, I should be able to get my back at 90 degrees. Now, a lot of my patients can't do that, and I get that. So this is what we're working towards. So putting your back up against a wall and having your feet bent, and then using a strap around your feet and pushing your feet out, and then releasing, keeping your back flat against the wall. That's one good option. You can also use a strap around your feet and keeping your back very flat and straight. Begin to lean forward towards your feet. So I'm keeping my back flat. I'm not rounding my spine out. This is going to stretch and strain the neck and the shoulders and not really going to do much for my low back. So I'm going to stretch down towards my feet, working forward just a little bit. I'm not really pushing, and I'm just hanging out here. You know, if you have a little bit of flexibility, that's going to be about all you can do. And eventually, if you hang out here long enough, it's going to start deepening up, okay? The next thing that I would like to talk about is glute activation. So frequently when our hip flexors are too tight, our glutes shut off. This is called lower cross syndrome. And so to reactivate your glutes, there's a couple things you can do. We have one exercise that we call deer in the headlights, where you're going to just simply lay on your back, flex one glute, flex the other glute with your hands on the side of your glute so you can feel what that feels like, and then relax, and then you're going to squeeze one, and then you're going to squeeze the other. Now, some people who've really lost glute activation are going to find that very difficult, and that is the only exercise that they're going to do, okay? But if you want to go to phase 2, you're going to do what's called a glute bridge. So in a glute bridge, I'm going to tuck my hips under, or I'm going to push my low back into the ground, and then I'm going to lift up off the ground, only till I go straight, nothing beyond that. In fact, if your glutes are really struggling or weak, you may only come up a little bit, but I want you to make sure that it's your glutes. To check and see if it's your glutes, you can lift one foot or lift the other foot. And what we're looking for here is if I was to lift this foot and I dropped my hip, that's going to tell me that I need to be working more on activation of that right glute. So again, you want to come into this glute bridge, hold this position for 3 minutes, and when you can hold this for 3 minutes, you can go to level 2. All right, take care of yourself, and as always, get to your chiropractor.